Hi, this is Dr. Kathleen O'Neil-Smith, and I'm here with my partner, Marika Grantham, and we are part of Treat Wellness and Shine.
Hi, everybody.
Hi. So what we're going to talk about today is permanent makeup. And Marika happens to have trained in doing permanent makeup, and the way she'll tell you a little bit more about this, but I think it's really important to note that she's trained with artists who take people who have been very sick, whether it's from cancers or the results of chemotherapies or other medical treatments, where they might lose their eyebrows, or they might have had breast cancer surgery and their nipples may have been impacted, or they might have had, other surgeries like
That creates scar tissues that have a different color of pigment.
that create scar tissue. And so what Marika does with her permanent makeup is she basically helps these people have a better external appearance, which is really, really important for the patient. So Marika's going to tell us a little bit about her permanent makeup.
So I was very excited when I dived into permanent makeup for a couple of reasons. First off, I had no eyebrows at that time. So it was very transformative for me to blade my own eyebrows and insert permanent makeup. And then I added my eyeliners, but what I love about the opportunity to work with people that have some disproportions, that they have some discoloration, people that have areas, again, as Kathy mentioned, scar tissues. As you know, when you have scar, if you go in the sun, it doesn't tan, it doesn't have a color. It has a very different texture. So we can address it in several ways. One is we can microneedle it, and we can actually put some of the own stem cells of yours and help with the texture. And also on a color end, we can actually microblade and soft up the pigment in your scar tissue and change it. I work with the people
So I want to make note of this. So what Marika's talking about is that we can use your own tissue or really healthy tissue like stem cells, peptides, or exosomes. And these are well known in the aesthetic industry. And we can begin to restore the tissue from the inside out using external techniques. And then on top of that, what she's saying is that we can then restore the color and the symmetry for you if there's scar tissue or there's something that is really bothering you with respect to what the world could see.
Yeah, and we all want to feel comfortable and confident in our own skin. So when I work with permanent makeup, Kathleen, one of the major things that I always keep in mind is that I want everybody to look as natural as possible.
Obviously.
So we don't want to create these looks. This is different if I apply regular makeup every day, but we want to create this character and looks that it looks your best. You wake up and you look your best. You look the most natural. You look like this is your own. This is how you were supposed to look like. Right. And that's beautiful. And to see that on people's faces when I can fix something that was off by Mother Nature, sometimes being a little bit cruel to us, and I can make them look good, and they look in the mirror and they're like, oh my God, I love it. When I receive the comments and texts from my clients that they are super excited how it makes them look and make them happy, that's so transformative for them, and it makes me so good about the work that we offer to clients.
And with aging, a lot of people, when you look at their face, they lose some of the structure and the outline of the face, and that's one of the things. Or someone who has thyroid disease, they may lose their eyebrows. When someone has alopecia, either their whole head, they lose their hair, whether it's partial alopecia or alopecia totalis, they lose all of their hair. We have mechanisms to help them grow their hair. So from bald to full heads of hair, and then to help it be restored to the natural color that it was. And it's really fun to do this kind of work and to really help people feel, so good about looking like themselves, about getting back to who they are and having people see them in the way that they see themselves.
So people can shine.
Treat Wellness and Shine, signing off.